This is a WECT Cape Fear Business Break.
Hello, Megan Donahue here with Dr. Jason Graff from Spinal Care of Wilmington. How are you, Dr. Graff?
I'm doing great.
Let's talk about chronic knee pain associated with arthritis.
Sure.
It's
sure.
osteoarthritis.
Yep, that's the correct saying. Basically what that means is just bone-on-bone arthritis in your knee, obviously. What happens over just throughout life, just walking and bending, just squatting, jumping, just life in general, the space in between the knee, contains some fluid, and throughout life you start to lose that fluid, the bones get close together, and you start to wear out the cartilage that protects the bone, and you're left with bone on bone, two bones rubbing together. Obviously going to hurt anything you do.
Right.
So patients are in a lot of pain.
Well, what are some treatments for them?
Usually when it's bone on bone, most patients are left with one of two options. One is surgery, like a knee replacement, and the other is non-surgical, where I can decompress the knee.
And tell us what's involved with that.
Well, basically the decompression process creates what's called negative pressure, which is kind of like a vacuum effect inside that knee joint, which then draws the fluid back into it to try to lift the bone off the bone so they're not rubbing. But you also want to repair the damaged cartilage, so we use what's called a class 4 laser to help repair that cartilage damage that's been done.
So is this a long-term treatment? Do you have to go back for multiple?
No, not necessarily long-term. I mean, these patients usually been suffering for years,
Right.
so the treatment I do usually takes 6 to 8 weeks on average, and then they're done.
And these people have been suffering for years.
Yeah.
Is the procedure itself painful?
Absolutely not. Everything I do in my office is actually painless.
Wow, and I know people want some relief from that pain. Find out more at spinalcareofwilmington.com.
For more details, go to healthfirst on WECT.com.